An intestinal stoma is when, during the treatment of colon cancer, for various reasons, a part of the intestine is brought out to the front abdominal wall, and bowel movements are passed through this opening. The stool is collected in a special bag that is attached to the abdomen, and the anal canal does not function. This can happen for various reasons. The first and most common reason is how rectal cancer was treated almost 100 years ago. All patients had their rectum removed along with the anal canal, and the end of the large intestine was brought out to the area of the anterior abdominal wall, and accordingly, the person for the rest of their life remained what is called a stoma patient, who has a stoma, and the evacuation of the large intestine is carried out through the intestinal stoma. Currently, the frequency of such operations in the treatment of rectal cancer is no more than 10 to 15%. This means that 9 out of 10 patients who are diagnosed with rectal cancer have a chance to be cured of this disease with the help of a so-called sphincter-preserving surgery, in which part of the rectum is removed, but the anal canal is preserved, and the healthy intestine can be attached to it, so the person will retain a normal passage for the intestines and normal bowel function, that is, of the large intestine. Sometimes, during such surgeries, a temporary stoma is created. In order to protect the sutures that the surgeon makes during the operation, a temporary intestinal stoma is formed, through which the large intestine is emptied. Stool does not enter the area of the sutures near the anal canal, and after about 1.5 to 2 months, this temporary stoma is usually closed, and normal intestinal passage is restored. An intestinal stoma can also be created for certain other diseases of the large intestine. For example, in cases of ulcerative colitis and Crohn's disease, when partial or complete removal of the diseased colon is required. Most often, such a stoma is permanent. It is created at the level of the small intestine and is called an ileostomy. But even people who, for various reasons, have had a stoma created can generally lead a normal life. And sometimes there are situations when, unfortunately, it is simply impossible to do without creating a stoma. This happens, for example, when the tumor is already quite advanced, it is spread, or the person has distant metastases. In such cases, a stoma is created as a means, essentially, to prolong the person's life when doctors are unable to completely cure the disease, if we're talking about stage 4, when, in addition to the primary tumor, there are already distant metastases. In such cases, a stoma is usually created as a result of emergency surgery in order to save the person's life and extend it for some time. That's why the patient's first priority is to see a doctor in time and not let their condition progress to an advanced stage, because only in the early stages, when the tumor hasn't spread, is radical treatment and complete removal of the tumor possible.